Hi, today we'll be doing our presentation on balance training. So the question that we came up with are the adaptations of balance training generalizable to reduce fall risks? This question was chosen because during balance training, perturbations occur in a controlled environment, and in real-world situations, one can expect when they're going to fall. The hypothesis is skills developed through balance training are generalizable. The reason we came up with this hypothesis is because balance training is a widely accepted practice in many healthcare settings to help improve fall risks of individuals. In the first study, it compared conventional balance training with reactive balance training. And conventional balance training is a type of training where individuals perform different types of exercises on unstable platforms like a foam pad or a Bosu ball. And reactive balance training is performed on a machine like the picture shown on the right, where a person stands on a platform and that platform performs perturbations underneath their feet. In the study, 24 females and 15 males were randomly assigned to either conventional balance training or reactive balance training, and they performed 3 sessions per week, lasting 20 minutes for 4 weeks. In the study, neuromuscular and kinematic data were measured to show muscular activity and also to look at the joint angles and how they improved over time. The study showed that both conventional balance training and reactive balance training participants significantly increased in neuromuscular and kinematic activity. Reactive balance training did show greater effects compared to conventional balance training, but there was no significant difference between conventional balance training and reactive balance training. Here, the data shows the neuromuscular activity and the kinematic data collected by the study. To the left, it shows the various muscles that were collected, and reactive balance training did show greater effect size for neuromuscular activity. And on the table to the right, you can see the amplitude and velocity degrees. And looking specifically at the velocity degrees, you can see that reactive balance training had a greater reduction, which is associated with improvements to reducing fall risks. Ultimately, the study does not support the hypothesis that balance training is generalizable. Improvements in neuromuscular and kinematic data shows positive adaptations to balance training. However, this is to highly specific activities, and it was performed on a healthy population. So it's hard to say that it can be applied to a real world scenario.
Okay, in study 2, there were 4 balance test. Sorry. In study 2, determined whether balance training improved the performance of a specific balancing task that was trained and untrained. This study examined 40 healthy individuals, 28 males and 12 females, averaging the age of 25. Each were assigned to one of 2 training groups and completed 6 sessions over the course of 2 weeks. These were the 4 balance tests that each participant was training to do. Through each session, the participant used the same preferred leg to balance with no shoe, holding their hands to their hips and gaze centered for the duration of the task. Each task was 20 seconds long, and they had 5 sessions per task. And so the first balance test was on a tilt board with the board's rotational axis aligned with the longitudinal axis of the foot, resulting in a medial-lateral direction of perturbation. The second test was also on the tilt board, but the board's rotational axis is perpendicular to the longitudinal axis of the foot. The third test is on a posterome with the longitudinal axis of the foot perpendicular to the release direction of the platform, resulting in a medial-lateral perturbation. Direction of perturbation. And then the fourth one is also on the same device, but the perturbation, the direction of perturbation is antero-posterior. Sorry, I screwed up. These charts show how before the test and after the significant difference in pre-testing and post-testing. You could see that there was much more improvement in their balance after these specific training tasks were done. So after the 2 weeks, participants showed improvement only in highly task-specific training. It was said that the best results are acquired when the task becomes more specific instead of general, and the study ultimately does not support our hypothesis. And to sum everything up, both findings in each study it is safe to say that both proved our initial hypothesis wrong. Balance training has always been a generalized type of training, but this form of training lacked any real improvements. The first study showed neuromuscular adaptations to balance training. The second study displayed how well the participants' balance improved after being given specific balance training. Our studies have proved our hypothesis wrong, and we now see that balance training mostly shows results that are specific to the activity one trains in. Thank you.